Hi, Mr. Sanchez. How are you today?
I'm okay. I'm just ready to go home.
I know. My name is Mohini. I'll be your pharmacist for today.
Okay.
Okay, so there's a couple of discharge meds that I want to go over with you before you leave. But before we do that, can I please verify your date of birth?
August 31st, 1958.
Okay, perfect. Thank you. And so I'm just going to list out all the meds first and their dosages, and then we'll get into the specifics.
Okay.
So you'll be taking the atorvastatin 40 milligrams, 1 tablet by mouth daily. The hydrochlorothiazide 25 milligrams, 1 tablet by mouth daily. The lisinopril 40 milligrams, 1 tablet by mouth daily. Atenolol 25 milligrams, 1 tablet by mouth daily. Famotidine 20 milligrams, 1 tablet by mouth twice a day. And then the tramadol is 50 milligrams as needed every 6 hours for your back pain. And so if you forget all of this, it's also on your vial, so you can go back and look at it. Okay, so let's start off with the, before I begin, do you have any allergies to any medications or anything at all?
I took motion and I got like some bleeding and I threw it up.
Okay, so there's no Motrin for you on there. Yeah, we took care of that. Okay, perfect. So let's start off with the ulcer pain that you have. So for that, you'll be taking famotidine, and how you'll take it is you'll take it in the morning before you eat. All right, and then some of the side effects that you might experience is mainly just nausea, a lot of it, and then some dizziness that you might experience. So nausea is a key one. And then now let's talk about your blood pressure. So there's actually 3 medications that you'll be on for your blood pressure. So it's the hydrochlorothiazide, the atenolol, and then the lisinopril. And I know you've taken lisinopril before as well. Yeah, so we discontinued your Procardia because it was too expensive.
Yeah, it's really expensive.
I know, I can understand. So we just replaced it with 2 drugs. So that'll help to maintain your blood pressure and also not charge you that much, All right, so for these meds, you would take them in the morning all together before you eat. So with the famotidine. Yeah, perfect. So it's easier for you. And so for some of the side effects, I would just want to go over some of the minor ones. So you might feel a drop in your blood pressure, and that's usually like indicated by maybe some lightheadedness or dizziness. So if you feel that, you might want to check your pulse to see if it's like doing okay. And also for the lisinopril, you might experience some angioedema, but this is a very rare and like it's if you experience it, you want to report to the ER right away. It's a swelling of the lips. So then you would report to the ER, but it's very rare, so you don't have to worry about that too much. We do want you to monitor your blood pressure at home to see how you're doing. So we want it to be under 140/90. So if you've seen that, that means you're doing well. So you want to bring that in next time so we can see how you're doing on your meds. Does that sound good? Okay, and also, so that's about it for the blood pressure medication. So let's move on to the cholesterol. So for cholesterol, you'll be taking the Lipitor. It's actually atorvastatin now. We replaced the Lipitor with the atorvastatin, so it's cheaper for you. Yeah, so we're trying to make it cost effective for you as well. And if it's the same, so you won't, there's no difference. We're not compromising on your health or anything. So you'll be taking that every night, once in the night. Yeah. So the other ones that we talked about in the morning. So this is the first one that you'll be taking at night. And the famotidine you'll be taking at night as well, because we said twice a day. So these 2 meds you'll be taking at night. So some of the side effects you might experience are like muscle pain and then jaundice. So jaundice is like if you have some darkening of the urine, pale stools, and maybe some yellowing of the skin and the eyes. You might experience that as well. So if you experience that, just let us know and we'll reduce your dose. And then for the last one is for pain. So you're taking tramadol for pain, and you'll be taking that just every 6 hours as you need. For your back pain. I know you have really bad back pain. I know. Yeah. Okay. And so some of the side effects that you might experience are constipation. That's a key one. You can take something over the counter for that if you do experience that. Also, respiratory depression is like basically shallow breathing, and that's when you overdose. If you overdose on the medication ever, so if you experience shallow breathing, you must report to the ER right away. That's just a more like rare, but just want to let you know. And please avoid alcohol and grapefruit juice on that. And please do not like drive or pick any heavy objects when you take this medication because it makes you drowsy. And lastly about this medication is that don't stop it abruptly. So if your back pain gets better, don't stop abruptly because it can cause seizures. Just talk to us and we'll slowly taper you off of it. Okay. So I know I gave you a lot of information right now. So is it okay if I ask you a couple of questions to kind of see if I've given you the information correctly?
Yeah.
Okay, perfect. So for your ulcer, what will you be taking?
I think it's called famotidine.
Mm-hmm. And how often will you take it?
Once in the morning and once at night.
Perfect. And then maybe some side effects you might experience.
Some nausea, I believe.
Yeah, that's a key one. And then for blood pressure, what are the 3 meds that you'll be taking?
Lisinopril, atenolol, and the last one has a weird name. It's like hydro something.
Yeah, hydrochlorothiazide.
Yeah.
Perfect. And so how will you be taking those medications?
Before breakfast.
Yeah, perfect. All of them. And then what about some side effects that you might experience on all of these?
I think you said headache.
Mm-hmm.
And that's all I could really remember.
Okay, that's okay. Just maybe some drowsiness or just headache, lightheadedness. That just indicates that maybe your blood pressure dropped, so you might want to check it at that time.
Okay.
And so, that's perfect. And then just be sure to monitor your blood pressure at home. Okay. And then for the cholesterol, what medication will you be taking?
Lipitor?
Yes, but we changed it to do you remember?
Something.
Yeah, atorvastatin.
Okay.
And then what some side effects that you might experience on it?
Like muscle pain.
Mm-hmm. Yes, perfect. And will you be taking that medication?
I think that one's at night, right?
Yes, that one's at night. There's another one you will be taking at night.
Famotidine.
Yes, perfect. And then the tramadol, which is for the pain, how will you be taking that?
As needed, whenever my back hurts.
Okay, and then some key points about that, if you remember.
Like don't take with alcohol. It can cause drowsiness, so I shouldn't drive.
Yes, perfect. And then one of the side effects, like a key one that you might experience.
Oh, I don't know. There's a lot.
I know. I'm sorry, but constipation is probably one.
Constipation.
Yes, but you got everything perfectly fine. And also for the cholesterol and the blood pressure, it's best to exercise about maybe 3 to 4 times a day if you can for 30 minutes.
Okay.
Maybe some like running, jogging, whatever you like, walking, but fast walking. And then also just lower the intake of a lot of sodium. Like, anything high in sodium you want to avoid, and also just very high like foods and fats. You want to make sure you avoid those as well, and just kind of decrease the intake on those. Yeah. And then also, if you miss a dose on any of these medications, you would want to wait. If it's more than 12 hours that you've skipped the dose, then you wait until the next day. But if it's been less than 12 hours, you can take that missed dose. Okay, and then how will you be storing the medication? Do you have any ways that you can think of that you'll be storing it?
Usually just in my medicine cabinet.
Yeah, so that's perfect. Just a cool, dry place, just away from kids. And then also for the refills, we can discuss about it the next time we meet. So I want you to come back to us within a month. And then we'll discuss your refills and how you're doing on these medications and just any other questions that you have for us. Okay, perfect. And so are there any other questions you have for me before we let you go?
No, I think I'm okay.
Okay, perfect.
Thank you.
Oh yeah, no problem, anytime. And you can call us or just come back if you have any other questions.
Okay, thank you.
Okay, bye.